Hello, I'm Dr. Brandt Gibson, and today I want to talk to you about vitamin B12 deficiency or neuropathy from lack of vitamin B12. And first things first, why is this important? Vitamin B12 is an essential nutrient. It needs to be part of your diet. It needs to be something that actually is regular in your diet, especially if you're taking like a folic acid supplement or something similar to that, because this is a key piece of development of myelin sheath. So if you start to lose the myelin sheath, then you start to lose the functioning of that nerve. As you remember, the myelin sheath, and especially in the larger nerves, is designed to speed up and improve the functioning of those nerves. So what's going to happen if you have a vitamin B12 deficiency? You're going to usually have a lack of coordination. You may have muscle weakness from a motor neuropathy. A lot of times you'll have the sensory neuropathy component, which includes pain, numbness, tingling, sensory loss of multiple different types, so forth. So vitamin B12 is very, very valuable, and it's something that you should definitely be looking into adding if it is missing. So let's talk about the causes. What are the causes of a vitamin B12 deficiency that could lead to peripheral neuropathy? Well, one is age. It has been noted that individuals over the age of 80, anywhere from 10 to 25% of individuals will have a peripheral neuropathy, or a vitamin B12 deficiency caused peripheral neuropathy. A strict vegetarian diet can lead to a vitamin B12 deficiency because the best sources of vitamin B12 come through animal products, including meats and eggs and dairy. If you have a lack of vitamin B12 for any reason in the system, that can actually lead to, of course, the deficiency of vitamin B12. Stomach acids. Did you know that it's important that you have good stomach acid for the absorption of vitamin B12? If you take a antacid or a H2 blocker, you can actually reduce the amount of vitamin B12 that's going to be absorbed. So you want to be careful with that. If you have an autoimmune disease, one of the possible side effects is a vitamin B12 deficiency. Pancreatic disease, you will get side effect of a vitamin B12 deficiency. Ileal resection or a Crohn's disease, either one of these can interfere with the absorption and actually lead to vitamin B12 deficiency. HIV, another one that directly interferes with the absorption. Gastric bypass surgery has been noted to cause a vitamin B12 deficiency. Even MS has been shown to cause a vitamin B12 deficiency because of the absorption and so forth. And the idea here is, depending on the cause of your vitamin B12 deficiency, sometimes just taking an oral vitamin B12 may not work. If you have an absorption problem where you're not absorbing vitamin B12, you could take in all the supplements you want orally and they're not going to work. And so you may have to consider doing shots, for example. And a lot of times shots are a valuable option for getting your vitamin B12. So the point is, if you have a peripheral neuropathy and a vitamin B12 deficiency, which can be tested, there are lab tests that will test for vitamin B12 deficiency. If you have this vitamin B12 deficiency, it is important that you find a way to improve your vitamin B12, because peripheral neuropathy is just one of the side effects. You can actually get anemia, pernicious anemia, for example, from a vitamin B12 deficiency. You can also get spinal cord damage, where it actually starts to damage the spinal cord itself, not just the individual nerves. So this is a big deal. This is Dr. Brandt Gibson, and this is your Neuropathy Nugget day 335, if I remember right, 335, peripheral neuropathy from vitamin B12.